Hello, everyone. I'm Lisa Hinton, Executive Director for the American Heart Association in Metro Chicago, and I'm joined today by Angela Odoms-Young, one of our Metro Chicago board members. Hi, Angela.
Hi, Lisa.
Thanks for your time today. Today we really want to talk about something that's been in the news a lot lately. Chicago's African American community has been hit particularly hard by the COVID-19 pandemic. Can you tell us a little bit more about what is happening and why?
Definitely. So, although we are focused on Chicago, COVID-19 has had a devastating impact on African Americans nationally. So we are seeing a similar pattern in Louisiana, Michigan, the same pattern that we are seeing in Illinois. So African Americans make up about 30% of the population in Chicago, but nearly 70% of the COVID-19 deaths in Chicago. So,
Thanks.
Oh, go ahead, Lisa. I'm sorry.
And say thanks, Angela. That's staggering. Why do you think that is?
So it's a similar story. We are dealing with COVID-19 right now, but these disparate impacts are really rooted in historic and systemic patterns and policies that have existed for many years. COVID is having a disproportionate impact on African American communities for several reasons. First, if we think about prevention or the multiple factors that contribute to risk, the first is the higher prevalence of chronic disease. As you know, this is American Heart Association. We know that African Americans have a higher prevalence of cardiovascular disease, diabetes, twice the rates of asthma, so high prevalence of respiratory diseases. And this higher prevalence really makes African Americans more vulnerable to COVID-19. And so those underlying conditions really are a strong predictor when you look at COVID-19 deaths. I think the second part of that is challenges related to social distancing. So we've been given orders to stay at home, to engage in social distancing to reduce our risk. But when you look at the wealth and income gap, Blacks are overrepresented in things like the service industry, so working in food service, grocery store clerks, warehouse jobs, home health care. Those essential services where people may have a more difficult time staying at home. African Americans disproportionately use public transportation. So it's hard to social distance when you are needing to rely on public transportation to get to work and to get to other duties that you would normally, when many people are staying at home, African Americans are disproportionately needing to still be engaged in those daily activities outside the home. Also, there was a report recently from the Bureau of Labor Statistics that indicated only about 20% of African Americans can engage in telework, so are in jobs where they can telecommute or work virtually. So this can be very difficult when you look at risk if the instructions are to engage in social distancing and you need to be out engaging in work that may put you at risk. Also, other studies show that African Americans are more likely to live in multi-generational households. So it's hard to go into social isolation when you live in a multi-generational household. It's difficult because even if you have seniors within your household, you may have younger people that are out engaging in work, but then you have seniors at home that those younger folks are caring for in a multi-generational household. So there's an increased possibility of risk. I think the second thing that can contribute to African Americans being more at risk when it comes to mortality from COVID-19 is screening and access to care. We have it's not new with COVID-19, but also with things like cardiovascular disease, diabetes, that African Americans have less access to care. less access to insurance, higher copays, and then less access to high quality care. So when you have a pandemic on top of even this higher prevalence of chronic conditions, then it can be a recipe for disaster. Early messages were related to only older adults. They didn't have that racial equity lens. So now we're seeing that African Americans are more at risk, but before there was a strong focus on older adults. And so probably younger African Americans, and I know there's been some discussion to maybe 50 and over instead of 60 and over in certain communities. So the message was that younger African Americans were not susceptible. And honestly, a lot of messages were that African Americans were not susceptible at all inside, internally in the community. So that may shape people's perception of how they engage in protective behaviors. So I think partly when we look at some of these things are more immediate and then some are more historic. And so it's important that we look at that layering, that this is sort of a layer on top of disadvantage, both economic, social, and then the health disadvantage that already existed in the African American community.
So many social factors that are influencing the numbers we are seeing, much of which already existed, right? This is not new. This is not a new reality. The pandemic is just shining a unique light on these systemic and economic, environmental injustices and inequities that have already existed. Mm-hmm. So with what we're starting to see and what we know now, what's the path forward from here?
So I think the first thing that we need to do is to look at these issues with a racial equity lens. When we think about things like screening or messaging, it becomes really important that we have the data to see who is at risk and what's the determinants of that risk. We have a lot of data now that's coming out for African Americans, but again, if you look at Latinx populations, Native American populations that share both, in some cases, a similar history or similar patterns of racial discrimination, similar patterns of racial inequity, we are likely going to see the same heightened risk in these populations. So I think it's critical first to collect the data. We need to have the data to tell the story. And that's the first step, is to really understand what's going on. I think the second is related to testing, to ensure that these communities, that there's testing centers in the communities that may be disproportionately at risk and disadvantaged. So free testing for COVID-19 in these communities to make sure that people are aware and are diagnosed and then treated. I think the other thing is related to just general equity in the system when it comes to making sure that these things don't happen again. We need to have policies in place already that require us to report data by race. We need to have policies that ensure equity in healthcare. Also deal with things like implicit bias in healthcare, so people won't be underdiagnosed and undertreated. There's also a few other things that are happening from a broader perspective. We know that African Americans are overrepresented in the criminal justice system, where people can't engage in social distancing. So part of the recommendations around the mass incarceration and really supporting to make sure that people are not put at risk is ensuring that those nonviolent offenders, if there are alternatives that can be put in place for their release. And several community advocates have encouraged that. You have many people that are pre-trial and they haven't even been convicted yet. We forget about that a large percentage of the population that's incarcerated in the U.S., they have not had a trial and they haven't been convicted. So some, that's not to advocate for violent offenders to be released, but some can be released so you can reduce overcrowding. The other is to make sure that people get the proper treatment. So when people are diagnosed, we need to ensure that they have ventilators, that those places where you have a high risk, that they have protective equipment for healthcare providers. And then I think in general, overall, is to not forget. We see in Chicago that some disparity emerging already in education, where public education they weren't already set up to engage in virtual learning, and people didn't have, all the people in the public education system didn't have technology at home. That's going to create a disparity that's not going to end when COVID-19 ends. And sometimes we forget that this was something that happened, there was an impact, but then now when things get back to normal, we don't realize that disparate access to resources has a long-term, it will have a long-term impact. Right now, people are able to get supports for not being evicted because they can't pay their housing costs because maybe they've been laid off related to a business that closed because of COVID-19. And again, we're not going to be able to, some people are not going to be able to make that up. So are there going to be supports in place in the long term? And so I think things like racial segregation, making sure we have an adequate healthcare system that can support all people, and really remembering that we're in this together. It's really no them and us, it's all. So when we think about the health in all policies, when we think about multiple communities, and really leveling the playing field to make sure that we reduce that inequity that exists for the long term. So when these things come up, we're not kind of telling the same old story.
Thank you, Angela. Well said. This definitely resonates, especially the piece of we are all in this together. This is not one person's problem or the others. What this pandemic has really shown us is how connected we all are. So great words there. Do you have any closing thoughts or final things we didn't get to that you'd like our audience to know?
I would just like to commend the American Heart Association for paying attention to this issue and also for reframing much of their work to look at social inequities and social and structural determinants of heart disease and cardiovascular disease. And so it's so important. I know there was a shift in a discussion about equity before this started. And I'm very excited to hear that many of our backbone organizations that engage in public health and that are focused on addressing and promoting policies that increase equity, that they're still in the fight with the COVID-19 as well. So thank you so much for allowing me to share information about COVID-19 in the African American community. Is greatly appreciated.
Wonderful. Thanks for your time today, Angela. It's always a pleasure to see you, even virtually. We hope everyone stays safe and healthy. Take care.